Good afternoon. This is Pam with Your Nurse Advocate Consulting and also Patient Advocate Match. And we are super, super excited today. I have a coworker with me, another nurse that I work with, Jade Pusel, and she is a certified ostomy nurse. So we're going to get right into it. Hopefully, we're going to have some tips and tricks. And I know this isn't the most sexy or glamorous topic, to talk about ostomy care. But you know what? If somebody doesn't talk about it, how are you going to find out this information? So we're raw and real when it comes to talking about taking care of yourself and improving your health. So we're going to get right into it. So Jade, I'd like to welcome you, and we're going to go ahead and get started. So this is just our team. Jade is a guest presenter for today. So we included Jade in today's presentation in our PowerPoint. And so some of the things that we're going to look at is we're going to look at, some routine care. What are the 3 different types of ostomies? What are some troubleshooting? Jade's going to talk about leaks or if your wafer doesn't stick properly. Also, she's got some ostomy secrets she's going to share. And also we'll talk about, we'll ask Jade to tell us, just when is the right time that maybe you need to call the doctor. All right. So we're going to get, Jade, would you like to tell us just the 3 different types of ostomies?
Yeah. So there's 2 different types of ostomies that people can have. There's the colostomy, which is in the colon. So you see more formed stools with those. Ileostomies are higher up. They're in the small bowel. So typically looser stools seen with that one. And then urostomies, which actually is a very broad term, that is a urinary diversion versus a fecal diversion. But you could have a lot of different types of urostomies.
All right. Thank you. Okay. So when we're talking about routine care and hygiene, Jade, is there any recommendations that you have for just what's the best way, like maybe to clean your bag, or how often should you change? Is there any kind of general rules of thumb?
So the general rule of thumb for that is half or less you should be emptying your bag. Now, if you're somebody who has a colostomy, you're probably noticing you don't have to empty it as often, whereas if you have an ileostomy, which we consider a high output stoma, you would want to be emptying it much more frequently. And when I say frequently, I mean some people have to empty it 10 or more times a day. But it just kind of depends on the person. But really, you should not be letting that bag get over half full ever. And if you have a larger bag for those times where you have more output and you can't empty it, you should empty that even more frequently because you don't want it getting heavy.
Okay. And so what about any, hygiene tricks or, I know people, one of the things with having an ostomy is just, your, and what's the term I'm looking for? Not your self-perception, but your
Image?
Your image. Yes. Self-image. Yes. Yes. So, is there any kind of things that they can use, if people are self-conscious about the odor or things like that?
Oh my gosh, there's so many products out there that people don't even realize exist. And it's not just one company that carries them. There's so many different companies and they all have something like this. So they all have deodorizers. Sometimes it's like a charcoal like product. Sometimes it's just a made deodorant that has they make them scentless and they also make them like a fresh scent.
Okay, we just Jade has a baby at home, so we're very forgiving. So Natalie, play on. We're okay with that. So,
but they also have products. Ostomy Secrets is a great company that makes clothing products for men and women to help conceal your bag, make you feel more confident about having that underneath all of your clothing. That's a huge thing that people, when I ask people what worries them the most, a lot of times it's, are people going to be able to see it? And no, they don't have to see it. And no, they don't have to know that you have it unless you want them to know. So there's so many different options out there. I could talk for hours about them, but ostomysecrets.com is the clothing website.
Okay, thanks for that, Jade. So when we're talking about hygiene, how often should they change their wafer and how should they clean their skin? A little bit about that.
So typically, a good wafer fit for you should last you 3 to 5 days. Some people they're happy if they can get 3 days, and some people can get 7 days. It just kind of depends on the person and the type of output that you have coming through your stoma. But typically, if you can get your wafer to last 3 to 5 days with no leaks, then you are doing a fantastic job. Um, and as far as cleaning when you take that wafer off, the biggest thing that you should be doing first is assessing the back of that wafer. So you should, when you take that wafer off, look at the back of it, and is it eroded? Meaning, is there output from your stoma that's getting to the back of that wafer and eating away? Because if it is, it's sitting on your skin, and now you're going to have skin problems. So making sure that you're really looking at the back of that wafer to make sure that there's no leakage in one certain area. And if there is, then you know that you have to try to figure out how to not let that happen again to protect your skin. And as far as cleaning your skin goes, I can tell you this over and over and over and over again, because it's the most important thing, is to make sure you have a good, clean, dry surface area and even surface area for pouching, bottom line. Because if you don't have that, you're not going to have success.
Okay, thanks, Jade. Is it okay? I mean, do you use regular soap and water? Is it just, can you shower or take a
Yeah.
bath?
Yeah, so you can, depending on the person and the type of ostomy you have, but they do make stoma caps, they're called, and it's just like well, it's just kind of what it sounds like. Instead of attaching a bag to your appliance, you attach this little cap. Now, people with ileostomies, that's not ideal for, because it's not going to catch any of that output. But a low output stoma, like a end colostomy, you can use those, and people actually use those even to go swimming. But you can use those in the shower. You can take your whole appliance off and shower if you feel comfortable with that. If you have an ileostomy, you're going to get some stool in your shower because those are high output. But it's not a bad thing to do. It's more of a personal preference. But yeah, you can use regular soap and water. If you're allergic to soap, obviously, don't use it. But it's treated just like any other part of your body.
Awesome. That's great tips, Jade. And going to, after talking with Ostomy Secrets, so you mentioned a little bit some tips if they're having trouble, purchasing their supplies. What are some of the resources for that?
There's so many resources out there that people don't even know exist. And when I say financial concerns, I mean, like, a lot of times people will have, like, my insurance covers it and I only have to pay $20, but I switched insurances and now I have this a month gap period where I can't afford my supplies because out of pocket it costs me over $500. So if you're having anything like that, or you're in between jobs, so you don't have coverage for 3 months or something like that, there are resources for you to get supplies at a very low cost to no cost. So if you live in a large area, you probably have like some sort of closet that people will donate supplies to that they'll just hand out. But otherwise, I have listed there, if you look, ostomy211.org is a nonprofit organization that people donate money to, they donate supplies to, and you can get them at a very, very low cost. And I'm talking like, sometimes you can get, like, depending on what kind of wafer you use, but sometimes you can get like 20 wafers for $5. And all you do is pay that price. And then I don't know, if you buy so much of it, you pay a little bit shipping, I think, but it's very, very low cost. Ostogroup.org is another one that's very similar to Ostomy 211. Ostomy 101 it's an app on your phone that you can download. and I actually helped a patient with this not that long ago, and I just discovered it. And they have coupons on there. So they have coupons for different sites and different products through manufacturers that you can get as well. And it's got great resources on it for more than just that. So that I would encourage people, if they don't have that, to use it. I've not looked on Amazon a great deal, but I have heard people recommend that who needed to get extra supplies or whatever and needed it for a lower cost. So it's an option.
Yep, great resources. And I know too with Amazon, one of the nice things with Amazon is, especially if you're an Amazon Prime, is they pay for the shipping. And
Yep.
usually there's a pretty quick turnaround time. So
Yep.
if you're getting low on something and your supply's not coming, if you had to use more, then that might be an option. So
Yep.
great information, Jade. Okay, let's talk a little bit about troubleshooting and some tips. So this is kind of where the rubber meets the road, and I think can be troublesome and very frustrating, especially when you have a new ostomy and your stoma size changes because it'll shrink and and all those kind of joyful things. But Jade, can you just kind of touch base on those and walk us through some of those things?
So I feel like the two biggest things that people complain about or worry about, I should say, is what happens if I can't get it to stick? Well, if your wafer's not sticking, then you're not going to have a pouch to put on to contain it. So it's very worrisome to people. And if you don't have, we talked about a clean, dry surface area. And with that being said, you want it to be an even surface area. So if you have a stoma that has any crevices around it, if it's close to like a skin fold, or if it's whether you're standing up straight, bending over, whatever it is. So as a nurse, I try to assess my patients for that too. When they bend over, is it still an even surface, or now do I have a crack that's forming, and that's why my seal is breaking and not sticking? So just make sure that you have a nice even surface. And if you don't, there are products to help you, but you really want to try to do the best you can without adding a bunch of products if you don't need to. So definitely reach out to one of your resources, your wound care nurse or your provider, if you're concerned and want to maybe try one of those. If you don't have, to pouch over, yeah. Are you using skin prep is the other one. So most people, and I say that because I truly believe all people, but there are some people with an exception to this, that you should be using a skin prep. So our skin, when we put adhesive on the same spot over and over and over again, our skin doesn't like it. And some people's skin who really does like adhesive won't after a while, because that skin layer will actually come off if you're not careful. So you should be using a skin prep to not only protect the skin under the wafer, but also to help it stick. And they make sprays and wipes. It really doesn't matter. Find something that works for you.
Okay. And so with that being said, is there a time or do they need to check with their provider? Is there a time, Jade, when they would use, say, like a stoma paste?
Yeah. So if you don't have that even surface area, they make products. They make stoma paste, which I use when I absolutely have to. It's not my favorite product. They make different hydrocolloid fillers. People sometimes trying to think of what the other really popular one is. I can't think of it off the top of my head, but there's a lot of different products out there, and it's more provider preference. My child's eating dog food right now.
You're excused, Jade. The next thing, when Jade comes back, we're going to talk about leaking. So we're going to look at how long since you changed your wafer, is your stoma retracted or flush? And then we're going to talk a little bit about convexity. Then we're also going to just talk about some tips. So Jade's got some did you know kind of statements that she's going to share with you. So Jade, whenever you're ready, we're going to talk about leaking a little bit.
Oh, yes. If you're having leakage problems, If you're
And if
having
you need,
problems, oh, sorry.
if you need to pick her up or anything, go right ahead.
If you're having problems with leaking, I kind of already talked about, like, looking at the back of the wafer to see if you're having that leaking, and maybe you need to fill in those crevices that are forming that you don't even realize are there. Um, but how long has it been since you changed your wafer? Some people are like, well, you said I should be able to go 5 days and it's only been 4. Well, maybe 4 days is too long for you. Maybe you need to go every 3. Or do you need a different type of wafer? Maybe that one's not good for you. The other thing with that is what does your stoma look like? What does your stoma look like? Is it retracted? So there's, that means, does it go in? Or is it flush with your skin? Because if it's flush with your skin or retracted, is it leaking underneath that because it's sitting there and so it's eating away at that wafer? That's a huge issue. And underneath that, I wrote the word convexity. And what that means is they make wafers that actually have convexity built into them, and it pushes down around your stoma so that the effluent or the stool coming out of it goes out into the bag instead of staying close to the skin. That will help with leaking. It'll help your wafer stick. However, convexity is something, do not use it unless your provider approves it. Because it is a higher risk product if you have certain conditions or certain anatomy, depending on what kind of stoma, where it is, that sort of thing. So don't use that without asking your provider first, but you can always ask about it if you think it might be something that you'd like to try. And then they can tell you if it's appropriate for you to try that or not.
So Jade, that might be a product, again, with the doctor, with the provider's blessing, would address those if they've got like a flush stoma or a stoma
Absolutely.
that's
Yep.
retracted. Okay, perfect.
One of the biggest things with convexity is, like, if you have a hernia, because one of the biggest, I'll say a subsequent condition, I don't know what to call it, is when you get a stoma placed, a lot of times people will get a hernia then from it. So if you have a hernia, 9 times out of 10, they're not going to allow you to use convexity because it can cause you more damage than it is good. So that would be one reason they wouldn't use convexity, but it absolutely can be an option for flush or retracted stomas.
Awesome. And now let's run over to the tip side. So, Jade, do you want to just review some of the tips that you'd shared with us?
Yeah. So I already kind of talked a little bit about deodorants, but a lot of people say, well, other than being able to hide it from people, their biggest question is, well, is it going to stink? And yep, it probably is, because most stool does stink. But they do make deodorants that you can use. Every company makes a deodorant that you can use. Like I said, some of them have fragrance, some of them are fragrance free. Whatever you would choose.
Do they make, and I know this is kind of a crazy question, but this just popped in my mind. Do they make like a product like a poopery that you could put in there that just like takes away the odor? I mean,
so they make tablets, they make liquid, and they make a gel. I know that there's a lot of patients, or I'll say ostomates, that use things that I cannot actually recommend. But they will find things that work around the house. I've heard things like Tic Tacs, Altoids that they're putting in their bag. As a healthcare provider, I can't technically recommend those things. But I will hear a lot of people say that they use that at home.
gotcha.
So there's lots of things that you can do to help with deodorize.
And the last tip that you had talked about making disposable waste bags for discreet disposal of ostomy pouches.
Yeah, I'm telling you, they come up with everything, Pam. They have disposable bags. So having a baby, they make sassy sacks, so you can, like, disguised poopy diapers when you're out in public, kind of like the smell of them or whatever. Well, they kind of have the same thing for this. They don't call them sassy sacks. They call them disposable waste bags, but it's kind of the same thing. You can put your pouch into this bag and tie it up and throw it anywhere, and it helps disguise the smell of it and the looks of it. They also make like pouch liners, they're called. Most of them say flushable pouch liners. I would be cautious about that in your own home. But they do make things like that to help make it easier to dispose of, less messy for some people, I suppose. It's all a personal preference, though.
Gotcha. Thanks. Lots of good tips.
Oh,
So,
there's
any recommendations, Jade, when things aren't going quite right, or when should they reach out to their provider?
so I would say one of the biggest things to call your doctor about that I think people let go too far a lot of times is if you're seeing what we call peristomal skin complications. So that means under your wafer, your skin doesn't look like the skin next to it on your stomach where there isn't a wafer or pouch. So it's red, or there's skin breakdown under there. You see wounds, um, things that don't look normal to you. And even if it's been going on for a while, and so you're like, well, it's normal because it's been happening for 5 months, so it's still not normal. And you really do need to go see your doctor, because until that gets taken care of, it's only going to get worse. Um, so that those absolutely need to be brought to your provider, or wound care nurse, or whoever you see needs to know about that, and they will help you, because it may need medication. It may cause a systemic infection that lands you in the hospital. So it's not something to mess around with, for sure. Um, Other things to see your doctor for, if you're really struggling, some people can use the same system for 3 years and all of a sudden it's not working anymore for them. So obviously you're the patient and it's up to you to try different products. But if you're trying different products and it's not working, don't wait too long. Go see somebody, because if you're using the wrong products and it's not sticking well and you're having a lot of leaking, then you're risking your skin breakdown, and it's just not worth it.
Awesome. Anything else you can think of for the doctor, or do you think that covers it?
Those are the big ones I feel like that
Okay.
people let go too long.
Okay. Jade, can you think of any common questions that you get as an ostomy nurse from people or from your patients?
I kind of covered it. The smell, like how do I conceal my bag? Those seem to be the most common ones. The other thing I guess that people with new ostomies worry about more than ostomates that have had theirs for a long time is, what do I do in the middle of the night if I need something? And the answer to that is there are a lot of resources. So, depending on what company you use, they may have like a 24/7 like hotline number that they can at least give you guidance until you can see your provider the next day or something, or call the clinic the next day. But also the UOAA is the National Ostomy um, accredited website, I guess is what it's called. Um, and they have support. You can They have support numbers, I think, on the bottom of their homepage that you can call. They have support groups. They're kind of few and far between, but if you live in a larger area, they're more readily accessible. But they also have like a blog on there where you can talk to other people who have ostomies too. And so sometimes just being able to talk to somebody else who's been through it too is super helpful. And I guess with that being said too, if you're a Facebook person, there are groups all over Facebook of ostomates that talk about things that work for them and things that haven't worked for them. And sometimes they have great tips and tricks for you as well.
Awesome. Jade, this has been a tremendous amount of, I think, valuable information, letting people know that they're not alone out there. There are resources, there's things that they could do. As we wrap up, Jade, is there anything that that you can think of that we haven't touched on, or anything that you feel that you'd like to share about managing ostomies before we wrap it up?
Gosh, I mean, I could talk about this for hours, Pam. But no, I feel like we hit the big topics. Just know, if I can tell you anything, know that if something's not working for you, don't get discouraged. There are so many different products and different companies out there that have great products. So if something's not working for you, don't give up. Reach out to your provider, reach out to your nurse, and just say, hey, this isn't working. We need to try something else. And they have samples. You can get free samples from manufacturers to try different products. So just don't get discouraged. Reach out for help, because you're not the only one with that problem. Everybody goes through this at some point in their stoma and ostomy journey. Oh,
All right. Well,
yay!
yeah, we did. Mommy did a great job. So, Jade, just in wrapping up, I just want to say thank you so much for being willing to give up a day off and share your beautiful little girl with us. And help you
Thanks
do
for
this.
having me.
But we really appreciate it, and it's been a lot of great knowledge. So, with that being said, we are going to go ahead and we are going to end our presentation. Thank you everyone for joining us. Don't forget, we want to thank those that's going to catch this on the replay, and it'll be posted on the Facebook group. So thanks everybody for joining us. Thank you, Jade, so much for your help. Bye, Natalie. All right, take care.
Bye.
Bye-bye.